My name's Clare Collins and I'm a Laureate Professor in Nutrition and Dietetics at the University of Newcastle. I'm also the Director of the Food and Nutrition Research Program for Hunter Medical Research Institute, and importantly, I'm an NHMRC Senior Research Fellow. My career journey really began when I was still at school and I heard about this profession called a dietitian. So as part of that journey, I did a science degree in Queensland, Australia. I then moved to Sydney and did a dietetics postgraduate diploma. And then I got my first job in Newcastle, New South Wales, Australia. And it was working as a clinical dietitian that I got very interested in solving clinical research questions. I did a PhD on young people who have a chronic condition called cystic fibrosis. And then over the next 30 years, I really morphed into a research leader, with my whole career being here at the University of Newcastle, which is in New South Wales, Australia. As an NHMRC Research Fellow, and that stands for the National Health and Medical Research Council of Australia, which is our peak funding body for medical research, I hold what's called a Level 3 investigator grant. So that's at quite a senior level, but what is wonderful is that it comes with not only your salary, but also the project funding. So for 5 years, I get to focus on precision and personalised nutrition. And what I'm doing in that is I'm looking at how genetics affects your risk for diet-related disease. Then I'm looking at how individuals vary in their response to specific types of diets, healthy diets, unhealthy diets. You have diabetes or you have heart disease, and measuring tiny molecules that appear in plasma and urine. They're called metabolites that may be able to be used to identify not just the dietary response, but the monitoring. Imagine if there was a test that you could take that said, yes, your diet's healthy, or yes, you respond to a dietary intervention. This could really revolutionise the way that we deliver nutrition-related health care and how we decide who should be treated or who will not respond and perhaps need medication therapy earlier in their health journey. I get my passion from the excitement of discovery right through to seeing the impact that it can make at the personal level when somebody does improve their dietary patterns and feel better or get better. I fall asleep at night dreaming about that, and I wake up ready to start each day to get to work on the new discoveries. Outside of work, the things that keep me feeling good is swimming, Pilates, and walking, and I do all of those quite a lot. And then you're probably not surprised to know that I really love cooking. That's the practical side of my profession. And I do love sewing and reading, but to be honest, I have not as much time for those as I'd like to.